Hey guys, welcome back to my channel. Today I'm going to be talking about advice on how to be the best student you could be at the hospital that you're working at. If you are currently a respiratory student or a nursing student and you're worried about going into clinicals, or you recently started going to clinicals, this is going to be the best video to kind of give you some pointers on how to be the best student. Because keep in mind, every single clinical place you go to is a job interview. And so you want to be on your best behavior, but also make the best impression without looking a little bit needy. So if you're interested in watching this, I'm going to go over some points on how to be the best student at your clinical site. Hey guys, I'm Daniel from Dolder Media, and today I'm going to be talking about different points on making you the best student at your job site or at your clinical site. Like I said before in the intro, every single time you go to a clinical site, any kind of externship or internship, everybody's watching you, and it is an interview process. Even though you might not get hired at that particular place, or you don't even want to work there, everybody's still watching you, and everybody communicates with other hospitals. The place I work at and the place I went to clinicals at, the RTs there also worked at many other hospitals. So within about a month, if you do something, the word can pass on to other cities. So let's say a student in San Francisco did something that's really ridiculous, and an RT that works there also works with me. They're going to come back to my clinical site and say, can you believe we had this student that did this thing? And that word's going to spread pretty quickly. So as a student, there's things you want to watch out for, and this is what I'm going to go over right now. So advice number one, you want to be on your best behavior. Now, if the RT that you're with for a few days is really cool and they let you kind of slack off a little bit, maybe text, maybe go on some breaks, that's absolutely fine. But if another RT comes by and asks you to help them out or observe something, you should be willing to jump at that opportunity. This is something that they look for. Like as an RT, that I'm pretty relaxed with the students that I have. But if a student that I'm with, after a few weeks, I see that they kind of don't want to go anywhere with me, that starts becoming very apparent to everybody in the whole department. And if you're a student and you're with an RT that's really cool letting you do things, it's absolutely fine to do whatever they're letting you do, as long as it's allowed by the school and by the hospital. But if they're telling you could go sit down and play on your phone for a little bit, that's absolutely fine. Now, if you as a student start sitting down a little bit too much, that's also fine. But if there's something exciting going on, like an intubation, some kind of procedure that's going on that you've probably not seen before, or that you should see, you should jump on the opportunity to go see that. This is your job interview. So when you do get that opportunity presented and you brush off some of the more exciting things or some of the more high-risk procedures, that's something that people notice. And do that enough times and people might start talking, or people just might not be really interested in your work ethic, and you're almost guaranteed of not getting hired at the place you're at. So my first advice is just kind of be on your best behavior. Be the best person you can be and show the people that you're really interested in working. This shouldn't be fake. You should always be pretty interested in going and jumping on helping other people. But especially as a student, the eyes are kind of on you. You kind of have to impress yourself. You don't have years of experience to show off. You don't really have anything. The only thing you really have to show off is your eagerness and your ability to really kind of be interested. Advice number two, you don't want to get too personal. If you're working with an RT and you guys open up, that's 100% acceptable and cool. But let's say you're sitting in the break department and other RTs and you start talking about something, or the RTs start talking about amongst themselves. You don't necessarily have that rapport with the people yet, so you jumping in and telling them stories about your personal life, although it might be cool, keep in mind that you don't have the rapport established yet. It takes years of working with people to really develop that closeness where they could just talk about whatever they want at work. And as a student, you're only there for a month, 2 months, maybe at top 4 months. And if you're sitting there in the department and you don't really have an established relationship with the people there, yet you start kind of intervening yourself, the people aren't going to be rude. They're not going to tell you to, hey, stop talking or whatever. But as a student, it's going to look bad. Over time, you're kind of going to start rubbing heads with people, and it's just going to make you look worse than you actually are. You might be the best person there is, but unless you establish rapport with people, just try to keep to yourself. Be more of a listener than a talker. This is something that's going to go a long way. If people are there, they're willing to show you things. They're going out of their way to help you out, train you, and give you skills and skill sets that you've never had before. the least you could do is kind of interrupt and butt heads and try to fit in. It's not necessarily your job to fit in, your job is to learn as a student. And sometimes that line gets crossed. I haven't really seen too much of that, but when I was a student, I've witnessed other students cross lines. This goes across the board for every profession. I've seen nursing students, interns for like residents. I've seen a lot of people cross their lines, and you could see the face of the doctor or the nurse that they're with, and they kind of have this cringe moment where it's like, uh. So just kind of stay in your lane, be a student, learn, do what you're there to do. You're not there to make friends. You're probably not going to see most of those people again unless you get hired. And the only way to get hired is staying in your lane, listen, and try not to be too buddy-buddy. Let the people really come to you and become friends with you first. Third piece of advice that I have is be very punctual. Do not show up late. Try not to leave early. If the people you're with tell you could leave early, maybe leave early if they say it's cool. But honestly, stay there till the last minute. Show that you want to be there. If the RT is there, you should be there too. This is going to be your future job. And I know those 5-10 minutes of you driving home earlier is pretty nice. But you leaving home 10 minutes early every single time does have implication. Like, the people that remember you always will remember you as the person who left early. Even though that was not even a negative thing. It was a fine thing. They told you could leave early. But it still has an impact later on down the road when they remember you. They're going to be like, oh yeah, that's the person I left early all the time. Or that's the person I showed up late all the time. Look, you're a student. You should show up on time or even earlier every single time. That's your job. Honestly, it's unfair, I know, because a lot of times you're not getting paid, or 99% of the time you're not paid, unless you're a resident or something where you're getting paid minimum wage. But show up early. Show up and show them that you're willing to work, and just be energetic, be ready to work. Advice number 4, pick up on your mistakes. Now, you as a student, if it's your first term, second, third, maybe it's your last term, and you're going to make some mistakes along the way. That's why you're there. It's absolutely fine, but pick up on your mistakes. My advice to you is learn quickly from your mistakes. And if it's something that you do make mistakes with, let them know, hey, look, I'm still struggling with this, but I do want to get this down. Now, let's say you, as a student, miss an ABG your first time. That's absolutely fine. Let's say you miss it your second, third, fourth time even. That's getting a little bit shaky, but it's also fine. Now, if you consistently keep missing and you get to the point where you give up and you don't want to try even, that's going to show you in a negative light. What you want to do in that situation is say, hey, look, I actually have been missing a lot, and is there any technique that you can give me that I can actually improve my skills into getting arterial or ABG sticks or anything like that? Let's say you did something a little bit worse that could even be life-threatening. That's why you're with an RT that's watching what you're doing. They're making sure you're okay. Let's say you give a medication on the wrong liter flow, which again, it might not necessarily be detrimental, but let's say you put up the small volume nebulizer, only put it up to 3 liters. Or if you're in nursing school and you make an actual mistake that could harm the patient. The reason somebody's there with you is to catch you. Now, when they catch you, you're supposed to learn from that mistake. If the next time you're with that patient you make the same mistake, all it takes is one extra time of something like that for them to dismiss you and your credibility. Once you lose your credibility with a therapist or a few therapists, you're pretty much not going to get a job at that place. The people do not look at you like a competent individual. Even though you're still learning, you need to be able to quickly adjust to the big mistakes. And if it's a small mistake, learn through it and ask them for advice. So my advice to you is, again, pick up quickly. If you learn from your mistakes, if you did something in your clinicals, it's not the end of the world. It's going to be fine. Go home. Spend that whole week really thinking about it. But if all you did was play video games that whole week and you come back and make the exact same mistake next week, that's going to have a really bad light on you. And once that bad light is on you, it's really hard to turn that bad light off of you. My last piece of advice for you is just to take it easy. Now, even though it is a really stressful thing, people are watching you, you're learning new skills, it's very stressful, you just came back from a week of finals, you might even have a part-time or full-time job, it's understandable. But you're not the RT, you're the student. You're allowed to make mistakes, you're allowed to ask questions, you're not supposed to know everything. So don't go into a clinical site expecting to have all the answers. That might come off badly. if you don't know something, it's okay for you to go ask a question. Say, hey, look, I'm not familiar with vents this much. Can you show me this, or can you explain this? You shouldn't be this tight and just really rigid individual. I know that it's going to be difficult to take it easy and relax, but always in the back of your mind, remember that you're just a student. You're not even getting paid. You're helping out and you're learning along the way. Actually, you're mostly learning along the way, helping out very little until you actually get really good at it, and then you actually can be very helpful. But you're a student, nevertheless. Don't forget, just relax, just chill out. If you really need to take extra breaks so you can actually, figure out a way to cope with things that you're seeing, or if you just haven't figured out your flow, it's okay for you to tell the therapist. Just be comfortable with them and say, look, this is all new to me. Is there a way I can manage with my stress better? Can I take like a 5-minute break just to kind of recoup my thoughts? I'm going to be back and better than I was. This is new to me. I haven't really seen deaths. Something like that. But either way, my last piece of advice, take it easy. It's not life ending. If any mistakes do happen, it's okay. You might mess up. You might do something stupid. It's not the end of the world. There's always a way out. So just be happy, be cool, don't be rigid, don't just stand there and just kind of be high anxiety. Just relax, be cool. Thank you guys for watching. If you guys like this, let me know. I'll make another video about this with more advice. Have a good day.